No, it's two different spots.
Yeah.
We did. That's what we did. We messed up. Cause this is the hosting spot. That's the Let me hold on. Okay, no, that's right. That's right. Okay, I'm wrong. I'm gonna get off of it on this one. Okay, go. Are we live? Oh, are we live? Okay, we live over there. So this one. We live. We live. We live. Hello. You got something about health? I still do about health. Let me see myself in the studio. We live. We live. We live. You want that by yourself? Look at you.
Trying to fix me.
You turn your head around.
Yeah.
We live. We live. We live. We're live in the studio here, over at the Custom Prints and Designs studio here with Miss Fam and Little Miss Destiny. Come over here. But we live. Why you change that? What you got there? What you got?
Why does it seem like it's so big?
You did that.
Oh,
Where it go to?
I see what you did. I see what you gotta do. There.
Edit it.
And then the box.
Mm-hmm. Go up a little bit. Hit on there. Hit save. Now. Bam! Ooh.
Just learn something new again.
Okay. Let's see. I think we're live. We're live. We're live.
Good morning, America.
He said, "Good morning, America." I don't know if it's probably more. It's morning somewhere. It's morning somewhere.
What it do? It's 5 o'clock for sure.
That's all I'm talking
But
about.
I ain't got no red bull today.
Why you got a red bull?
I don't know.
You need a
I
red
ain't
bull?
being toxic today.
Oh, man. Maya!
I'm being good today.
We're finna get us some red. We're finna get toxic on this joke today.
How you doing?
Mm-hmm. I'm doing good. I'm doing good. I see you down there, Stephanie, in the cut. We'll get you in a few minutes, okay? I see you down there in the cut.
Okay, Pam.
Okay. Give me just a second. We're on the live podcast.
Okay, go ahead.
Grab us a couple Red Bulls out the refrigerator over there. Please. Stop. We're having a Stephanie. She just Oh, there she go. There she go. There she go. I see you, Stephanie, down there in the cut. Let's see.
Hello.
Hey, Stephanie.
Are we live?
Yes, we are live. We always live.
You were supposed to say something before I went live.
we really just getting going here real good. I wanted you to know that I did it. I wanted to acknowledge you being down there, but we'll give you a few minutes and we're gonna just open up and then we'll bring you back in a few minutes, okay? Give about 20 minutes, okay? Okay.
Okay.
Okay. All right.
Hey y'all, how y'all doing today?
Yeah, we got a live guest tonight.
So we on talking about healthcare today.
Yeah, the state of our healthcare, the unwinding of it, what's happening in our community, because we don't like to go to the doctor around these jokers. You know what I'm saying? I ain't saying me per se, or Destiny per se,
I don't.
but you know,
I don't. I ain't even.
we as a group of individuals, we don't like to see the doctor.
But that's just because I think I'm my own doctor. I feel like I can diagnose myself all the time. I be on Google.
That's what's wrong with you, Dr.
I be on my Google or my mama old books because she in the medical field. And you know, long story short, that's what ended up happening every single time. So yeah, a lot of our problem in our community is that we don't take our health serious, and we don't try to look for deals on insurance. We automatically just go with what we get from work and different things like that, and we got to start doing our research with these companies and seeing what they really do for us Black people, because we all we got, and we need to start doing better with our health and learning about different things that's affecting our Black people. So another thing too with us, I know that like a lot of us, we are high risk, and not because we are unemployed or underrepresented when it comes to when we do get employment. Like I said, us not really knowing the different packages out there, or people not really teaching us about the different packages for health insurance and different things like that. So we really just got to get better as Black people, addressing and talking about healthcare and our health. Period. So, I know that a lot of us, we like a lot of the common health issues that we have is like heart disease, high blood pressure, cancer, diabetes, stroke, artery disease, sickle cell, and like they try to say like HIV and AIDS, but I mean, you know, those are the different like common diseases that we all deal with in the Black community. But it's a lot more out there, like thyroid problems. I've been hearing a lot of Black people talk about they having thyroid problems and different things like that. So yeah, I was just saying that, like I was just talking about how, you know, we don't really do our research when it comes to health insurance.
Right.
And then I was also just naming like different diseases that's common like within us, Black people.
Exactly.
But that's all I was saying when you was gone.
Okay, yeah. And I kind of heard you a little bit. You know, I was out the room, but I wasn't out of hearing shot. But as she said, there's a lot of different healthcare issues going on within our community, and different things that's happening in our community that we don't always seem to address.
Mm-hmm.
And we try to we ignore. And I'm gonna tell you, one of the things that a lot of us shy away from is getting colonoscopies and things like that, breast exam, different things like that. We don't. If it ain't broke, don't fix it. But you can catch things early on before it start giving you problems. So there's a lot going on with our healthcare. But what I want to do is because we have a special guest, we're gonna bring her back in just a few minutes. Um, but she has her own healthcare clinic and it's a free clinic too, you know. So I'm gonna bring her back. I'm gonna bring her back in. Let her do some talking, and then me and Miss Lady, we're gonna come back. We're gonna let y'all know how we've been doing the last week and everything, and we'll close it out with our shenanigans. Cause I'm just getting my first Red Bull of the day, and I think she's just getting hers too, hers hers too, and we're just gonna get out, let that wind down, let Miss Stephanie get in here and talk, um, and everything, so we can get some of the meat of this before we put in our shenanigans. You know how we like to do. So we're gonna bring her back in. Miss Stephanie.
Yes, ma'am.
We bringing you back in, hon. We're gonna let you lead us out and talk because me and Destiny, we get into a little shenanigans in this podcast sometimes. So we want to let you bring in the serious situation that we got going on with our healthcare in the state that it's in and everything. So we'll let you do the talking, and then we'll add what we need to add, and then we'll put our shenanigans on the end after you go.
So let me ask the question. Am I live right now? Or are we
yes,
still
ma'am,
backstage?
You live right now, ma'am.
Can you hear me okay?
We can hear you perfectly, ma'am.
Okay, because I'm driving.
Okay. Because you're a busy lady. You're always on the go trying to take care of that business. You can tell them a little bit about you. I kind of let them know that you had a foundation. You had a free healthcare clinic, if that's correctly for me to say, located here in the city of Milwaukee. But you can explain a little better to everybody about you than I can.
Okay, so good evening, everyone. My name is Dr. Stephanie Finley. I am a doctor of behavioral health, but I'm also in medical school to become a naturopathic physician. And so naturopathic means that we don't always go for the conventional methods that a lot of the healthcare practices practice here in our area. I believe in doing some holistic things because if we eat right and have the right herbs and things, our body is supposed to be able to heal itself from within. And so I want to teach my people how to heal their own bodies from some of the things that are happening to it. But I wanted to come on here today to talk about the public health unwinding, because the public health unwinding ends on May 11th as it relates to the COVID pandemic. And with the unwinding of the public health emergency, that means that for the last 2-3 years, if you were Medicaid, you didn't have to reapply. Governor Evers just automatically made sure that you had health insurance. And so with the emergency unwinding, you now have to apply in order to keep your health insurance. And so we're not really sure how many people it is going to impact, because right now what's happening is you've had it for the last 2-3 years without having to submit income, without having to go for a review. But you've been able to have it without having to meet any of the co-pays that you had in the past based on your income. And so I'm a little concerned for the people who do not have it or will not reapply for it. And so we have the Finley Medical Clinic that's located at 107th and Capitol Drive. We are a hybrid clinic. And what I mean by hybrid, we accept patients who have insurance. We accept patients who are uninsured. And the patients who are uninsured, there is a copay for you to get your health care services taken care of. And so you would come in and meet with a financial advisor or a case manager who can help you navigate based on your income what that payment will be. Two, one of the things that we do different than any other health system in this community is your first appointment, your first wellness exam appointment with us is 90 minutes. A lot of times, Pam, what ends up happening is a lot of our people don't know the language. They don't really know what's going on with them. They don't even really know how to communicate it. They don't even really know, okay, if the pain is, if it's a constant pain, is it a pain that just shoots out? And so we have to spend a lot of time listening to our patients. And as we listen, we begin to understand some of the things that are happening with them. And a lot of times the symptoms that our patients have, they think it's normal because it's always been like this for them. And a lot of the symptoms that they are having are not normal, but because they don't know any better, they never go to the doctor and they never figure out that it's normal or not normal. And so we have a community that's in crisis because there's so many people who are dying because their blood pressures are so off the chart. Listen, blood pressure is a serious, serious health condition. And the number of men and women who come into our clinic and their health, their blood pressures are 200 over 120. I'm just like, wait, hold on. The first thing I have to do is get you some water, because what we don't understand as a people is that water, we have to drink the water in order to flush the organs. If what you are eating is high in salt, you have to drink the water. If you don't drink the water, then your blood pressure will continue to skyrocket. And so just getting the people to understand drinking room temperature water or cold water, I don't care how you get it down, because we got to bring the pressure down. And so getting them to understand that taking medication is not a death sentence. Maybe you don't want to take the blood pressure medication, but maybe you need to understand that whatever treatment plan that we come up with is to the best of your, it's going to benefit you. My treatment plan, it could just be that every morning and every evening at dinner, you drink you a cup of tea and add some cinnamon and some nutmeg in it to keep your blood pressure down.
Okay.
If you're able to do that, but that means you have to be consistent. And what happens with our people, we talk about putting them holistic and natural treatment plans, and they say, oh, that stuff don't work. Well, guess what? It doesn't work because the key word is consistency. If you're not going to be consistent with your treatment plan, no matter if they put you on a pharmaceutical drug or if they put you on something holistic, you still have to be consistent in taking that stuff. I have to drink my tea every morning before I leave the house with my nutmeg and my cinnamon in it, because it's going to keep my blood pressure down. When I come in from a long day of work and I don't been through hell or high water, dealing with the coworkers, dealing with I need to drink me some tea with my nutmeg and my cinnamon in it, because I'm sure after a day's work, there's been some time during the day that your pressure has escalated and you're not aware of it. But the number one thing is making sure that you monitor your own blood pressure. I have people come in and I'm like, honey, your head has to be hurting. Your blood pressure is not 220 over 110 and you're not experiencing some form of headache. There's no way. Oh, now that you mention it, I have, but I just keep going. No, a lot of people are keeping going and they're dropping dead because they don't recognize the symptoms. And the symptoms are what's killing them because they don't recognize it. They're not paying attention. And I don't know, a lot of people do not understand how their body works. Your body will shut down if you're not taking care of it properly. It will sit you down.
Yes, it do. I ain't gonna tell you no story. I'm a true firm believer and witness to that one. Because
it will put you on a bed of affliction. Yes. You have to if your body is if you are tired and you are dragging, you don't consider to keep running and keep going because you're tired. No, you stop. You get the proper rest. You drink the water. You eat a healthy meal. You take care of the temple. If you're not going to take care of your temple will definitely make it your business that you will be in somebody's hospital or laid up in bed at home and not being able to get out of bed because you refuse to take care of yourself. And so with I'm sorry.
And I've been there, done that, and I ain't even gonna play with it. It's everything you saying right now is like real, because every time I overdo it, my body let me know. Even though I think I'm tough and I'm strong, and I can do it. Every time it do it to me every rip. So I do understand
That's right.
that. Yeah.
And the body is and the body always sends us warning signs and signals that tells us that something is wrong, but we have to be in tune with oneself in order to listen.
Yeah.
Mm-hmm.
You have to listen to the body. You could tell when your body is dehydrated.
Yeah.
You could tell when your body is craving salt. You could tell a whole lot of different things about your body if you are paying attention.
Yep. You sure can.
And so my concern is for the people who are getting ready, the thousands of people who are getting ready to lose their Medicaid insurance because the pandemic is unwinding, and they're saying, what do? I do have high blood pressure. How am I supposed to get my medication? I don't have money to get my medication. Well, guess what? You call our clinic because we have free medication. If you can't afford to get your medication, there is no excuse for you not to be able to get your high blood pressure medication, your diabetes medication, because we provide it for free, especially for those who do not have insurance.
What about...
Say that again. One more time. Say that part again, the last part.
If you do not have insurance, we provide you with your medication for free.
Okay. All right. That's all I'm saying. So, like you said, ain't no reason why nobody can say they can't. No reason why you can say you don't have it, or you don't have it, or you won't try to get it, because it's there. It's available for you. It's available to you for free.
And not only is it available to you for free, there's no reason why you shouldn't be able to go to the doctor, because whether you have insurance or not, we're there to serve. Exactly. Not only are we there to serve, whether it's mental health, whether it's physical health, whether it is supportive services, or, you and your family, y'all are paying, you've been bringing in $1,200 a month, but you paying out $900 of it towards rent. Listen, you cannot sustain yourself that way. If you cannot sustain yourself that way, it makes it very hard to not have to end up in eviction court. You can call our office. We have a case manager who can help you put a financial plan together, help you find an apartment that is not going to stress your income.
Sure. What's the address again?
It is 10721 West Capitol Drive.
Okay.
And the suite
what's
is
what's your hours?
110. Our hours are Monday through Friday, 9 a.m. to 5 p.m. And our phone number is 414-988-3079.
Okay. 988-3079.
Yeah.
Okay, y'all heard that, right? Because I think it's important for us to know this stuff. And
it's very important for people to know that there are resources that are available to them, so that they're not out here saying they can't get their medication, or they can't go see a doctor because they don't have insurance, or because they don't have money, or because of this or because of that. We need for people to understand that we are here to serve.
Exactly. And that's what's important, being here to serve and being able to get what we need. And when we can't get it, if we can't get it, you know what I'm saying? If we don't have the money to pay for the medication. If it's somebody that can provide us that medication until we're able to pay for it, wonderful. And we need to know that because I ain't too proud to ask for the medication that I need. I hope ain't nobody else too proud to do that. Give me that number one more time, Stephanie. 414
988 3079. Yeah, so we're here. So our supportive services and our case managers are available to help you. I don't care if you need Pampers, you need baby wipes, you need menstruation pads, you need tampons, you need incontinence supplies for your grandmother, you need compression socks, you need some personal care items to take care of yourself. We understand all of that. We understand that there are needs out here that go above what some of these other places are willing to do. And so we are here to provide a service. We're a safe space.
Exactly. And that's what we need. We need
a safe space. You don't have to worry about, coming to our facility and getting your stuff and having to wonder if somebody talking about you. No, I want to be sure that you have everything that you need. I need to put a care package for you. If you don't have food at your house to feed you and your families, I need to be able to direct you to one of our food pantry partners where you could go pick up you some food for you and your family.
Okay. That's all I'm saying. That's all I'm saying. Amen.
And Miss Stephanie, this is your business, right?
We're a nonprofit, so we have a board. Our board takes care of the community, and so I just want the community to understand that we are here. We even have health navigators who can help you sign up to get insurance through the marketplace or help you fill out the paperwork to keep your Medicaid insurance, because a lot of people don't know how to do that. We have navigators to help you be able to do that.
But just step back a little bit. Stephanie, you're the founder of this organization, though, correct, ma'am?
My father is the founder.
Okay.
I'm a foot soldier.
You're a foot soldier. Okay, all right, amen. Okay, I just want to give you your flowers, because this what you're doing, So amen. So you carrying on that legacy. That's what you're doing. Amen.
That's right, legacy building. And so part of it was making sure that people receive what they need in order to eliminate any barriers. And so if you have a barrier, you know how stressful it can be if you're experiencing some type of stressful situation. Your mind can't really think your way through it. Sometimes you need to call somebody who can help you.
Okay. Amen. I put that number on auto dial, speed dial in my phone, because I promise, and I don't have a problem with making sure that I can pay for my health care and things like that. But just to find somebody within my community that I can talk to, sometimes that's a little easier than stepping outside the community. So I really, really appreciate the fact that your organization is doing this for our community, because this is what we need within our community, because it's a lot. It's a lot, It's a lot.
Besides Medicare and Medicaid, do you know any other cheap insurances for young people that don't have kids necessarily, or you know what I mean? Do you know any cheap or low costing insurance, health insurance?
So there's the marketplace. We like to call it Obamacare. They give you a subsidy based on how much money you bring in a month. So sometimes you may end up paying $4 a month based on your income through the subsidy, and the federal government kicks in and pays the rest of it so that you are covered.
Okay.
And so our office is, like I said, we are healthcare navigators. We have healthcare navigators available based on your income, based on your circumstances. You could call our office and come in and see us, or you could say, you know what, I don't have no transportation. Can we do this over the phone? Yeah, we can do this over the phone. We can help you do your Medicaid application. We can help you with the marketplace application so that you are covered with insurance.
Okay.
Amen. Y'all heard that? Y'all can call over the phone if you don't. So that's if you ain't got time to do that, you ain't trying to take care of yourself. And that's a sad thing within our community that a lot of us don't try to take care of ourselves when it's put right in our face to be able to take care of ourselves. You know, we should want to take care of ourselves and want to do the right thing for ourselves, our health, and to make sure that we are here to make sure that our children are taken care of properly and that we are able to leave a legacy for our children. Like your dad, he set you up where when he set this organization up, he knew what you was gonna do. He knew what you was gonna do, Stephanie. He knew you were gonna step up and do what you supposed to did. When he was ready to sit back, and say, okay, all right. You know, so
But
amen.
I think it's a real good conversation to have for like young people too, like my age and younger. Because you know, like I said earlier, I don't feel like we take it as serious as we should.
No.
You know, and like for me, for example, like, and I'm not trying to make it about me or you know whatever, but I don't take it as serious as I'm supposed to.
Right.
So you know, it's great to hear like people that got a lot of resources and things like that. Like seriously,
exactly. And I think we all because that was a thing, and a thing if you ain't bleeding, you don't need no stitches. If a Band-Aid can cover it up, if some alcohol or some peroxide can put it on there, throw a Band-Aid on it and keep playing, keep going. You know,
and our young people think that they're invincible. They have no fear. They think that they're going to live a long time. And I cannot tell you how many young people have died over the last few weeks just from heart attacks. It just breaks.
And, oh my God, I'm so happy you just said that. My cousin, she only probably 30, not even 30. I would think she only like 20 something. She just had a heart attack.
Wow. Yep.
She just had a heart attack.
What is going on that a 30-year-old woman had a heart attack?
Well, partly because a lot of them are working a lot of jobs. You know, some of these women are working 2 and 3 jobs. And even some of these young guys, they're trying to stay out of trouble. I had a young 21-year-old who came in a few weeks ago. His blood pressure was like 169 over 103. And I'm like, baby, I got to go to work. You know what? I get that you got to go to work. But guess what? If you were to drop dead today, that company will find a replacement. That's right. They're going to find a replacement. You have to slow down and take care of yourself. It cannot always be about the money. And I know everybody is always talking about chasing the bag. We got to chase to make sure we're taking care of ourselves while we're chasing the bag.
Amen.
We gotta take care of ourselves for the bag, for that bag just be chasing us. And I'm talking about the body bag.
Exactly, because it's snatching bodies all day long, and there's no age that it's not coming for. But you got to be willing to, like I said, you got to listen to your body. I've known about the 26-year-old who laid in the bed for 3 days having chest pains and then go to the doctor and died from a heart attack. 26. It breaks my heart because some of this stuff is preventable.
He laid in the bed for 3 days without going to see somebody?
Without going to see somebody. It's a whole lot of people out here. I'm just going to lay down.
I mean, that's what almost happened with me with my thyroid problem. I was just going to go lay down, and I almost died. Then my mama and the guy I was with had to come make me go to the hospital. And I almost died.
So imagine if they didn't come for you, what would have happened?
Exactly.
So you got to have somebody to say, call and check on you and be like, you know what? You've been in that bed for 3. Nope, I'm coming to get you. We're going to the hospital right now.
Right.
That's crazy.
Yeah, they can call our office 414-988-3079 and talk to a healthcare navigator, whether you need some Medicaid or whether you need an inexpensive policy through the federal government marketplace for your insurance, or if you just feel like, you know what, I don't have no money to help. How much y'all charge me to come through the wellness exam? Yep, come talk to a case manager and they'll help you fill out the paperwork so that you can pay your copay to be seen.
Amen.
Some people don't have a monthly anything to give anybody for health insurance, even though they're giving them a subsidy. They're giving you a subsidy. They paying $400 and you may have to pay $20.
Mm.
But if you ain't got the 20, I get it.
Right. And like you said, another thing you said, I took a note of, and it's in my head that y'all can probably help them find an apartment that ain't put them in a strain. Help them find somewhere to live. And it's really hard. I'm gonna be honest. Today, in today's market, period, it is very hard to find somewhere to live because
somewhere clean, somewhere affordable, somewhere you ain't got to worry about roaches and rats. Running rampant through the property. No, we deal with this on a daily basis, trying to find our families affordable and clean housing, and it's not putting a constraint on their income. It just baffles me to have people come in and they're paying these exorbitant amount of rent and they living in a dump anyway.
Right, man, and it's sad. It's sad. You know what I'm saying? It's really sad. It makes me sad. Because I know people that's living in places that's way above what they can afford, but it's the cheapest thing they can afford. And like you said, they got a slumlord, or the rodents is trying to put them out.
Yep.
I'm talking about something. This is my house, man. I know you pay the rent, but this is my house, man.
Yeah, right. You can't even feed your kids because they gonna get the food before your kids get it, and so it's just some places. Because I was talking to some people last week, and they talking about how the rats are running rampant on the east side. Like, I'm like, oh my God! This ain't just a black thing. This is just a neighborhood thing. No matter where you live, you can be exposed.
And I'm not trying to be funny or nothing, but look, I be thinking, look, my auntie know how I am. I be thinking too much. I feel like that could be a setup. They could have did that on purpose. Because I don't understand. Like, it'd be crazy to me, like the bed bug pandemic or the epidemic and the now the rodents and this, that, and the other. Like,
if you're a Virgo, you got rodents.
Don't start. We ain't gonna go there.
That's another thing between me and her. We get a little messy. She loves to mess with me about them zodiac signs. So if you a Leo, you got rats.
Oh no, we don't do rats, baby. We don't do that. We don't do that. I'm gonna always represent the Leos over here.
This Leo behavior.
This toxic Leo right here.
Look, she got a whole picture of me. Look.
Miss said toxic Leo. Oh, that's funny.
She stood me up one week. Funny. She went to go have surgery to keep from being up and hit me 1 week. I'm like, girl, you ain't got to have surgery to not come to work one day. That's what she did to me, Stephanie. It's terrible how she did it.
Yet again, that was part of the health, though.
Yep, that was the health.
Anyway,
the Monday before that, she's like, touch my belly right here. What's this here, T? And both of that hernia. Why by that Sunday she was having emergency surgery?
Yeah. See, that's
and
how
it
works.
All day, my arm hurt.
Yep.
And next thing you know, she went to the emergency room. Her mama made her go, and she having emergency surgery that same day.
Yep. But you know what? That's nothing but the hand of God on your mama.
Yep.
Yeah.
That's the hand of God on your mama working through her to get to you. And hopefully that you are paying attention to some of these lessons that you have learned over the last few months about your health.
Yeah, I'm trying. Look, I'm working on it. I've been taking my medicine. Yeah, my auntie got on me about taking my medicine. I've been taking my medicine.
Tell me you're not going to take your medicine. You're going to tell me. I'm just going to be like, okay.
I've been doing better.
Yeah, it's medicine is not easy, and it's hard if you've never had to take it before. All of a sudden, you got to take something in order to, fix something. It's very difficult, but you know what? Just like y'all get out here and use these telephones for everything else, set a reminder on your phone, on your calendar that you need to take your medication.
Well, I take every day. Yeah,
but we also got to get us a cute little device to fill it up with our medicine and just carry it around with us.
And carry it around with us and throw it in our purse or put it in our pocket. But I'm just saying, there are too many ways to keep us connected to our medication in order for us to say, oh, I don't like taking it, or I forgot to take. No, you can't forget. You can't forget. There's too many ways to do this. A lot of us even got Alexa in our home. Alexa, set a reminder for me to take my meds at 9 p.m.
Right.
Alexa gonna pop off of that mouth all day long, every day at 9 o'clock to remind you to take your medication.
And I hate taking medication, Stephanie. You know, I went from taking like 3 pills a day to I take 48 pills a day.
Oh wow, that's a lot.
It's a lot, and I make jokes about it. I be like, I'm getting full off medicine. I don't got to eat today. I'm getting full off medicine.
But you're not taking them all. You taking them at different times during the day, right?
Yeah, right. Yeah, not all at one time.
Yeah,
some in the morning, some in the afternoon, and some at night. Yeah, bedtime.
Okay.
So yeah. But it drives me crazy because I don't want to take it half the time. I don't.
Yeah, but what's your alternative?
Yeah, exactly.
So you either want to live, or you ready to commit suicide, because that's what a lot of people are doing. If you're not willing to take your medication, you're setting yourself up for a suicide because you're going to die.
Exactly. And that's the thing. And that's what I be trying. I have to tell myself that every day. You know, I have to tell myself that every day that this is what I have to do in order to live, in order to want to function privately. I mean, function not privately, function properly. If I want to function properly, I gotta take my medication.
That's
I gotta do what I need to do, because if I don't, what's gonna happen? I'm gonna be sitting up here sick, not feeling good, mad at myself, all kinds of stuff. You know what I'm saying? Because I hate when I don't feel right, Stephanie, and I feel it when I don't feel right. It's like, man, I'm dragging, I'm fighting with myself, you know. And I mean, I have.
And then listen, you're a business owner, so that means that if you don't get up, you don't make no money.
And I'm gonna tell you something. That's the thing. And I said to myself the other day, I wasn't feeling good. I was down. My body just had me down, and I'm like, I came in here, but if I can't get no work done, I might well stay my butt at home in the bed. Because I'm not getting nothing done. I'm sitting in here with the door locked because I don't feel good. Only thing I can do is get up and go to the bathroom. Wasn't feeling good. My body hurting. Ain't nobody, you know. It's a shame. It's a shame. And like you said, and as a business owner, if I come in here, it's about production. That's what I feel like. It's about production, getting something done and getting what I have to get done, because I have a bottom line to meet and I have customers that depend on me. So I have to get in here and do what I have to do. And a lot of people don't understand that. They don't understand how I went through 14 weeks of chemotherapy and radiation, and every day I came to work, even if I wasn't feeling good. If I could, even if I had to sit there in the corner for a little while to get myself together. People didn't understand that. You know what I'm saying? And now having to start that process over again, it don't feel good. And now I don't really have no real workers. That's something I'm looking for. I'm looking for me some dependable workers that want to work and want to learn and understand this business that I'm in and want to become something. Because you got people that I think everybody looking for is a paycheck and a handout.
But they don't want to work.
They don't want to work.
Have you contacted any of the schools in their communication department for those who are interested in graphic?
And that was you. See, this is how my mind works sometimes. I have that short-term memory loss. I knew I spoke to somebody, and now it just came back to me now when you just said that was you. I was like, who was that told me to do that? And what department did they tell me to go to? So I got to call the communication department. That's what I'm going to do. I'm going to get in touch with communication departments in the at the colleges, and then try to figure out what we can do, what I can do. If you got some information,
I'll send you an email so that you won't forget.
Okay. And then if you know any other schools who I need to talk to, let me know send me who I need to call, because I'm gonna call them. You know, make it just one step easier for me. And what I want to start doing, I want to work on a network, Stephanie. This is something very important I want to do with us. Smaller businesses, just get together and build a network of contact things that we can do to help build our business up, because a lot of times it's very, very hard. you
It's
know,
very long, not only hard but lonely at the top.
it is lonely at the top. I promise you, it is. It's so lonely. But you know what? I'll be okay with that sometimes. I'll be okay with being alone. I'd rather be lonely and get it done than have a whole lot of company and still ain't getting it done.
Mm-hmm.
Part of it is, and I have to tell you about the stress because this weekend I was so stressed out. I was just like, oh my God, I need to figure out blah, 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 blah. And then I just got up Saturday morning and I just started texting people to tell them my story. Like, I need help. That's what I need help in. Cause I don't know if you the person I need to talk to, but whatever suggestion, idea, please call me, text me, whatever. Listen, we just got to do what we got to do.
Yeah, yeah.
There's
I agree.
and reaching out and asking for help.
Right. And that's something I don't want to have a problem. I don't want to be afraid or not know how, because I've been like that. I withdraw myself before I ask for help. And I know that's not a healthy way of being. And
Yeah.
I don't want to be that way, Stephanie. I don't, because I want to be able to, especially the people that will help me
Mm-hmm.
genuinely. See, I have a tendency of reaching to the wrong people for help. And then I'm getting these lemons and I'm upset because when I squeeze it, it ain't even a real lemon, it's hollow. It's just air
It's
pop out.
dry. There ain't no juice or nothing coming
Nothing
out.
in it. And I like a little juice every now and then, you know.
Right. Yeah, I get it. I get it. But no, I'm gonna send you the email so that
Mhm.
you can get that with that information because I won't forget.
Okay.
Even if you do, but then just call me at the end of the week so we can have some conversation.
Okay.
Some of the things that you need that I may be able to assist you with.
Okay, I will. And I want to say this too. I want to I just started because now, you know, I was dealing with ovarian cancer at first. Now I'm dealing with um stomach cancer. So
Mm.
um
So did it
I've been,
spread or was it separate?
I think it was separate. It didn't spread. It was separate. I don't have the ovarian cancer anymore. I
Okay.
I have just have stomach cancer, but they think that's where it started in my stomach in the beginning. But the ovary was just a product of from me having it in my stomach. So they think, because originally when I first got sick, I was having really bad stomach issues, but for
Mhm.
some reason they shifted to my ovaries, and
Mhm.
that's where they discovered, you know, a few fibroids, and then they found cancerous tumors in my ovaries. So that's kind of how it happened. Then the focus went off my stomach, but after I did what I had to do for that, that's when it came back, when they found it in my stomach. You know,
Mm.
but yeah, so I've been doing a lot of stuff. I've been looking into some stuff, some natural type stuff.
Holistic.
Yes,
Mhm.
and so I've been looking into juicing. So I just started juicing. I just
You're
started
not
juicing.
you're not one of them flaming hot type people, are you?
Oh, no, 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 no,
Oh,
no.
okay. Because I
Mm-mm.
know a lot of people end up with stomach cancer or colorectal because they dealing with them flaming hot.
Yeah, and so I told you that stuff ain't good for them kids. I had to fight with my baby about them doggone them hot chips and all that stuff. But
Yeah.
I'm only a hot sauce girl on certain things. You know, I
But
like my
but see, hot sauce is fine
uh-huh,
because you could take that like me. I take the give me a bag of regular chips,
uh-huh.
a regular Lay's, and sprinkle the hot sauce. Yeah, that's good. That's some good eating, even though it's salty. I just got to drink a gallon of water behind it. You just got to know how to you got to flush. You know what I
Know how
mean?
to balance it.
You got to have that balance. If you know you eating some stuff that is not really healthy for you, you got to know how to balance it out so that you're taking care of your body properly.
And that it's not just sitting in your system. That's deep. I feel that.
Exactly.
I
They
got
also,
something
I
from
mean,
that.
I'm
I
not
got
saying
something
that's
from
the
that.
same thing with the hot chips, but they do also tell you that with like drinking sodas. They tell you
I don't.
not to sip on sodas. You're supposed to just drink the whole thing and then go brush your teeth. Because people will let that acid, I mean that sugar and all that stuff sit on their teeth, and that's why a
That's
lot of
probably
these
why a
kids'
lot of
teeth be
people
jacked
don't
up.
have no teeth.
No, for real, because they don't
That's
know that
true.
you wait. You supposed to drink. You really supposed to drink sodas with a straw too.
Really?
You're supposed to drink it with a straw. You're supposed to drink it all in one sitting, and you're not supposed to sip on it. Or how some people like sip on sodas all day, or they take like they like have like a big soda and they drink it like all throughout the day. You ain't supposed to do that. You're supposed to just drink it, and then go brush your teeth.
Okay.
That's what they say you're supposed to do.
Okay.
I mean, but that's just another thing that I've learned over the years, being, you know. But I mean, that was off topic, but still, I mean,
No, it wasn't. That's on topic. That's about health, about our
Yeah.
healthcare and things like that. You know, so yeah. But that's that stuff that you said, you've been saying, Stephanie. It's just kind of like it's sticking in my head now. And to be honest, and this is not that I'm all the time I've been knowing you, that I didn't know that's what you were doing. I knew that's deep. I mean, when the health center thing, it kind of is like Stephanie just doing it, and not even as long as we've been knowing, and we don't just know each other like, hi Stephanie, hi Pam. We know each other. We don't sit at the same table before, things like that. So it's deep. So
and still sit at the same table.
Exactly.
Not as much as we used to, but we still family.
Exactly. So it's just deep that this is what and this is what I be saying, that we have to, if nothing else, find out what each other doing, because you could have had some life-saving stuff for me, and I never even touched on it with you. You know what I'm saying? As far as like healthcare things like that. So that's deep for me. That's deep for me. So
even if you see another healthcare provider and you need somebody to run some stuff by as to how to even advocate on your behalf, because what I see is a lot of seniors, they are afraid to go to the doctor because the doctor be in and out in like 10, 15 minutes. And by the time the doctor come in, they're like, I didn't get to ask my question. And I'm like, oh my God, what?
Hey, Stephanie, did you call me a senior?
I was talking about seniors in general, but
this one got that bad calling me old. Talking to, when I get older, I'm gonna do this. You know what I'm saying? Talking what she gonna do when she get older. When she like me, she gonna be crazy like me when she get older.
Don't believe her. I don't say that.
She don't call me all kinds of stuff before. I mean, right in my face. I just thought you was slipping one in too, Stephanie.
Oh no, I'm talking about
my age.
I'm talking about real seniors. You're not elder.
Thank you.
You auntie.
Thank you, Stephanie. I appreciate it.
There's a difference between auntie and elder.
You heard that, didn't you?
Don't believe her.
I got a video of it. Hey, I see you there. But yeah,
she be snitching on me, y'all.
I do. I have to tell on her. I have to tell her in her face though, because she's something else. Like she'll walk in here and say something to me. I'll be like, wait a minute, did she just say that to me?
She just got one in on you. You had to catch up.
She must have knew my purse was on the other side of the room, because they know I'm like Medea. I keep my steel in my purse.
Oh, well, on that note, I'm going to let y'all begin y'all shenanigans. I have to go. Thank you so much.
Thank you, Stephanie. We really appreciate you being here. We want you to come back again, Stephanie, because we really want to keep touching on, I don't care if we do it maybe once every couple months or something. We got to touch on healthcare and how we need to take care of ourselves. And if you don't want to go about it the traditional way, maybe there is some different methods of doing it and taking care of it. Because I'm sure I'm going to call you on some stuff for me, because I'm really trying to work on some stuff. But and I'm gonna bug the mess out of you. And don't be trying to send me no bill either.
Have a good night, ladies.
Okay, see you later. Thanks, Stephanie.
Bye.
Bye-bye. Okay, but yeah, that was Stephanie. I appreciate her stopping in and just helping us out, giving us some information about healthcare and things like that. So now, we got Stephanie out of here, y'all.
How you feel? How do you been feeling like about your health right now? Like how you
right
feel?
now, I actually I just started doing this juicing thing, and I have noticed some stuff. I've noticed that I am feeling a little bit lighter. Mm-hmm. Like as far as I still know, I ain't gonna lie, I ain't gonna tell you that I ain't ate a bag of chips here and there, and I ain't ate a little something here and there. I have, because this is new to me, but at the same token, if I'm doing more juicing than anything else, and I'm doing more body cleansing type stuff than anything else, it makes me feel a lot better. Okay. My body feel better. I feel like I'm not as sluggish. You know what I'm saying? And like sometimes I'm so used to laying in the bed in the morning, like making myself get up. I find myself jumping up now here lately, the last couple of days. When I wake up, even though I didn't want to get up Sunday morning, I was pissed. I was up early on Sunday morning. I I was up like 6 something, and then I went back to sleep, and then I back up about 8:30. No, 7:30, 7:30, 8 o'clock. I'm like, why? On a
I want
Sunday.
to go to sleep.
I
I
want to
want to
sleep.
stay asleep.
You know, and then I look
And-
over, I got Bailey in the bed with me, and I got Bingo in the bed with me, and I got Bella in the bed. So I got my baby and 2 dogs in the bed with me. How? And then Bailey gonna say, how did I get in the bed with you? How did Bingo get up here? How did Bella get? Because you put them up there and you came and got in the bed with me. But yeah, so I'm just, I'm feeling a change. I'm feeling a change, and then just not to get a little too gross. I'm looking at the way I use the bathroom differently too. It's just differently. I don't feel I don't feel I can't even explain. I feel cleansed. I'll say it like that.
Okay.
I feel cleansed.
So what have you been juicing? Like you just juice whatever you want to, or do you juice?
Actually, it's been fruit.
You don't do vegetables too?
I haven't done because I was talking to someone about it, a friend of mine's, and she was like, "Well, she been juicing, and I should try to juice, try juicing and everything." So, we went shopping, and she was like, the best way she was taught how to juice was like, say if I got pineapples, just do pineapples, um, um, do pineapples all by itself, just do pineapple, and I'm sorry, somebody was calling me. I had to send them a message. Just do all pineapples, and that's what I did. I like pineapple. Do all apples. Do all this. Just don't mix nothing together. Do one fruit at a time, and just do it like that.
Is that the seed?
That's to get my body regulated with it.
Okay.
And so that's what I've been doing. Like today, she actually I should have videotaped her here today. She came here today because I couldn't get this stuff done because my focus my focus is terrible, but I'm working on it. She came here today and she cut up all of them. I had some melons. I had the different melons, and she cut them all up and she juiced them individually, some berries, some strawberries. She just took them and cut them up and juiced them for me and put them in the jars for me. So I got enough juice to last me the next week or so.
Oh, that's nice. So what you drink it? You drink it 3 a day or just 1 a day?
What I do when I'm hungry, instead of eating food, I get me a regular 8-ounce cup, and I fill it up and I drink on that. And if I want to, because she the way she explained it to me, you can drink as much juice as you want.
Right. Yeah.
So I just been juicing. I just put me a little juice in a cup, keep filling the cup up all day long. Just juicing. I try to eat 1 meal a day. I've been doing a lot of boiled eggs. I like eggs, so I've been doing a lot of boiled eggs, and so usually in a day I might do some boiled eggs, and then the juice.
Okay, so over the years, I have done my research, and you said you only eat like 1 meal a day.
Mm-hmm.
From what I've heard, I heard that that's good.
Okay.
1 meal a day. I'm not saying that that's good for everybody.
Right.
But I've heard that that's good. Okay. Like 1 meal a day.
Okay.
I'm not saying and again, like I said, I'm not telling folks to just only eat 1 time a day.
Right.
You know what I'm saying? But I guess what I'm saying is that like it was like a holistic person that I was like watching one day, and they was talking about like how they split up their meals and different things like that. And he said he only eat like 1 meal a day, and he was like a nice built guy, had a nice
And see, this is my thing, and I'm like, I hate commercials. I hate commercials.
And that's crazy that you said that because I love commercials.
Because this is my thing. I don't want to see you all built up. I want to know that you had a few lumps like I got. You got a little bit more right here, a little bit too much here, a little flabby stuff right there. And then I want to see you in a year or two with whatever it took you to do it as this person. I'm not saying everybody's going to be cut. Everybody's going to have a 6-pack. True. Everybody's going to be this. But I want to see what the real difference is.
Like the results. Like real results.
Of it. You know what I'm saying? If it's only a result of feeling how you feel, if that's just the only results, then okay, that's the only results. But I just want to know what the results is. You don't got to sell me a dream, but if it makes my body feel healthier, if it cleanses my system and make me feel better, because I do feel a little better, you know what I'm saying? And I'm just starting this, you know what I'm saying? I'm starting the cleansing stuff. I'm doing what I supposed to kind of need to do. And then
have you been doing like weighing yourself too?
I haven't weighed myself, but I do want to weigh myself.
Do you feel like you losing weight?
I feel like I am losing weight.
Honestly, looking at you, I was just looking at you. I feel like you're losing weight.
Oh,
so I don't know if it's like and I'm not trying to say it like disrespectful or make you feel bad manner, but I don't know if it's the clothes that you got on today or what. But to me, I do feel like you look like you slimming up.
Right, and I'm gonna tell you something. Some of the stuff that I wear, some of my clothing that I have, I can tell the difference in how they fit me too. So I do think I'm losing something. And then if I wear a pair of leggings, now leggings, everybody know leggings. They gonna fit you, right? Yeah. If my leggings trying to fall off my butt, and y'all know, anybody that really know me know I got a butt. I ain't scared of the butt. But if my leggings is trying to fall off of me or slipping down, I gotta pull my leggings up constantly. I know I'm losing weight. Yeah. I know that. Even if I wash them and leave them in the dryer so they get extra tight, shrink a little bit, and then I put them on, and they still fall off of me. I know I'm losing a little weight. So
basically what she trying to tell y'all is go get y'all a juicer. That's what she said.
And they're not expensive either. They're not expensive. Only thing I'm trying to debate on.
Oh yeah, and by the way, we do got some like mini smoothie juicer things here at the cafe.
Yes, we do.
That you can buy. They only like $25. It depends on which one you want.
Exactly.
And the color.
And the color.
Because yellow is more expensive. No, I'm just joking. No, but seriously, we do got small like portable battery operated smoothie machine.
They're actually not. They charge up. You just plug it up at night, let it charge up, and you throw it in your book bag in the morning when you get ready to go. Bam, bam, bam. You can throw your fruit in there. You can put your fruit in there. Because what I would do, if I'm doing it every day, just blending them every single day, I would just throw them in a freezer bag and put them in the freezer. And then I would put my blender and stuff in a little bag. Oh yeah, and I'm working on something too. I may have some little book bags for your blender. Just throw your blender and your fruit in.
And she got some health products too.
Oh yeah,
some health products that like proteins and different things like that. That she's selling things.
Keep you looking young like me.
But so you said juicing is going good for you?
Yes.
Okay, so when I guess the only reason why I bring it back up is because when I was really working out, I had started working out like February.
Okay.
And I had went for like a month and a half, and I was going 4 days a week.
Okay.
Or when I got angry. So sometimes more than that, you know what I mean? Okay. But I was going like 3 days to 4 days a week, and then or sometimes more. And I was going consistently. I was doing classes. I had a personal trainer, and I was doing smoothies. I was doing smoothies every morning until I get up and I do the smoothies. And honestly, like my body was just like reacting to it in a good way. Like,
okay.
First of all, I was losing a lot of weight. Second of all, my stomach was getting flatter, which that's exactly what I wanted. And then third of all, like my body cravings was different. Like my body didn't crave chips. My body wasn't craving all them sugars and things, starches and stuff. Well, starch is sugar, but we just,
Exactly.
But it was a lot better for me. And and also too, another thing that a lot of people really need to really pay attention to is drinking a whole bunch of fruits and sugars. Right. Because people don't really realize that, fruit it got a lot of sugar in it. It's natural sugars, but it still got a lot of sugars, and people be forgetting to use their vegetables and take in a lot of vegetables as well. Okay. So, I just wanted to tell people that, like, the shit, smoothies and things like that. Of course, some of them have like avocado and broccoli and different things in it, but just remember, if you juicing and you doing smoothies, to still incorporate your vegetables. Don't forget about the vegetables.
Exactly. And green vegetables are the best vegetables. That's something I was told.
Yeah.
I was told that by my nutritionist. The green vegetables are the better vegetables. Certain vegetables ain't vegetables too, she was saying.
Yeah, no.
I'm trying to think exactly what she said. I think it was corn. Corn corn and
I mean, but who? I ain't gonna lie to you, Auntie.
and peas.
I would not put no dago corn.
No, I'm just saying, just vegetables. Like I love eating vegetables. I'll eat some corn. I like corn. I used to like
you
corn.
put corn in your smoothie?
Oh no. I'm saying just eating vegetables. Period.
Oh.
Just I used to love corn. And let me take that back. I used to love corn, but I don't eat corn. If I eat corn, it's probably because it's mixed in something else with mixed vegetables now. And I'm not just eating corn because I can't eat nothing and chew it to the maximum. And then I notice it when it come back. You know, it's like changing your baby diaper. You change your baby diaper. If your baby just start eating corn, it's like that. You see corn in your baby diaper. If your baby ate corn. I don't know about y'all.
I mean, yeah. So that's a good thing. That's a good question. How is that happening?
You know,
is your body putting it back together?
Right.
Look, I'm so look.
You
know me. There we go. There go the rabbit hole.
There she go.
See, you should never have told me that because now I gotta go down the rabbit hole.
Go down the rabbit hole because I'm telling you should.
Now that you think about it, when you eat corn, it do come back as corn. And I don't think I ever just swallowed a whole
I don't think
kernel of corn.
It comes back. That's something about that's that magic trick. You can never figure it out. But I'm telling you,
now you make me want to go eat some to see if it's gonna do it.
But yeah, peas and corn. She told me they're not really a good
ain't
vegetable.
Corn like starchy?
Yeah.
Is it? Or am I tripping?
I don't know. I can't tell you. I don't think corn is a starch. I don't know if corn is a starch or not. I have to look on the chart and see. But I'm not positive.
Because I was gonna say that makes sense because if starch is a sugar, you know what I mean. So, yeah. But long story short, the point of me bringing up the juicing and the things is because smoothies and all that stuff do actually work for you and it do get you full. I mean, some people know that, some people don't, but that's just something that we.
In a way, I think corn might be a starch. I have to, when you say something and it mess with me, I have to kind of look because I think you could turn corn into grain, can't you? So corn turns to grain. That grain makes bread and all that kind of stuff. So I guess corn would be a starch. I'll just want to see what them dogs are going to put on the table. So yeah, what is corn? Is corn a grain or a starch? Corn is a whole grain.
Oh, it's a grain.
A whole grain is just what it sounds like.
They contain vitamins, minerals, and fiber.
The whole grains are the most nutritious
kind of grain.
Question. They contain vitamins, minerals, and fiber. Okay, corn. So you're not a vegetable.
Wait, it said, is corn a fruit or a vegetable or a grain? It's up there, T.
Corn is something maize belongs to.
It's actually classified as a fruit. We just all learned something new, guys.
What was that word? Say it again.
Is it
Botanics? Who is that?
Botanists
as a fruit, as are tomatoes.
So
green peppers, cucumbers, zucchini, and other squashes.
So they saying that corn, tomatoes, green peppers. Look, we learning some new things today, guys.
I ain't eating that mess. Okay, I like corn though.
But yeah,
but I won't eat it like I used to. I used to take me some butter, some corn, and tear it up, a little salt. Did I hear my name? Okay. All right. I thought I heard my name.
So remember, okay, so what's the name of your products that you got too?
Oh, the new skin products?
Yeah, no, so it's not protein. That's not protein.
No, that's collagen. It's collagen.
Oh, okay.
So that's a substance that you can put into your smoothies or your drink or whatever. And,
okay.
And it helps build your collagen, keep you from wrinkling up and all that stuff. And then I got stuff, the skincare stuff that good for your skin that I need to start back using because I stopped using it. I stopped using because I got lazy.
Good.
Okay, like
That's my girl right
That's
there.
the problem.
She got
Well,
Eagle
black
stuff.
people, we got good skin. We don't need all little products. Okay, let me say that the right way. That's the problem with us brown people. We don't need all them products and stuff.
Okay.
We don't, but we do. Say some of us need it, but not all of us need it. Yeah, Auntie is one of the ones that don't need it.
Thank you, girl. Thank you, girl. That girl be talking about Eagles, you know. She was going for that 1 week, you know. She gonna make me get rid of this poster. I ain't ready yet. It's ripped a little bit right here, but I'm gonna get rid of it a little bit every week. I'm gonna take a little piece off until there ain't none left. Okay. But, yeah. So yeah.
Or Auntie don't know that I'm trying to what you call that? Brown nose.
Oh,
I want
Lord.
something. I want something. What is I want? No, I'm just playing.
Everything. What you want now?
No, but yeah.
Lord.
So
I'm gonna tell y'all what she wants. She ain't gonna tell me till we get off the camera. But believe me, be next week I'm gonna tell it what she
I love y'all. I don't want nothing today. I don't want nothing today.
She don't want it today, but she's gonna tell me about it today, and she might want it tomorrow.
Let's see. I want a babysitter.
Oh Lord. You know,
I'm trying to make my auntie one of them poor housewives.
No, one of them little slaves, baby slaves.
But don't start, auntie. Okay, so back to health. Alright, back to the health. So okay, so you say you feeling good. You've been feeling a little better.
Yeah, I have. I have been feeling a lot better because I don't know. I just do. I really do. I feel a lot better. I feel like I'm clean myself up, but I don't want to take it for granted because this is my problem, and I'm going to tell y'all my problem. I don't know about y'all problems and nothing like that, but my problem is I don't like forming habits. I got some habits. Don't get me wrong, and the ones I got, I got them, but I don't like forming habits. So when I start doing something over and over again, and then I form a habit with it, I be like, I ain't programming myself. Mm-hmm. You know, I got that thing, and it's like, you know, how can I explain it? This is the best way I can explain it. So I hope I don't offend anybody, but if I do, get over it because I'm just keeping it real. It's like doing a treatment program.
Okay.
I think a lot of people do treatment programs, and it's okay. I'm not saying it's wrong. They program themselves. It's like a cult. Like you program yourself to stop using the drugs or whatever it is you're doing. Mm-hmm. Whatever. You program yourself. And then you get to talking all this treatment talk and all that stuff. And see, I just don't want to be one of them kind of people. And I'm not saying ain't nothing wrong with treatment. Right. That's not what I'm saying. Right. What I'm saying is I don't want to program myself to something. I want to be okay with just changing my lifestyle and doing something. Do you know what I mean? I don't know if that makes sense. I'm sorry if it don't make sense to y'all, but it makes sense to me.
No, I'm just trying to make sure I understand what you're saying so I can read.
It's like how can I say it? I've never thought I was a habit. I'm a habit forming person. A lot of people can form a habit. Some people can do stuff that's not healthy for them. Or some people, I'm gonna say it like this. Some people they can form a habit easily. Mm-hmm. You can do something once or twice, and then it's a habit for you. You got to do it all the time, and that's kind of like when I think about it that way. I think about a person on drugs. You smoked a crack pipe one time, and now you're smoking it all the time, or you snort some heroin, or you shoot some heroin one time, and you're always I want to get high.
But you know what? I think that I'm like that the same way as you, because I can stop anything.
Yeah,
like. If I say today I want to stop, whatever the case may be, I can stop. And I'm not saying that, you know, I'm just like.
That's a good one, Kamaria. I like that. I got to see what I'm gonna look over here because I got it bigger over here because I'm blind, Kamaria. But I did see something. So you feel king of like a robot when you are in a habit or routine.
He was like you feel kind of you feel. Kind of like a robot when you are in the habit or routine.
Okay, yeah. And that's okay, Kanye. Okay. Sorry about that, Kamaria. But I made it big. I'm blind, you know I'm blind. But yeah, I don't want to be a robot. I don't want to be in that kind of type thing. And I don't know.
And you when you saying that, you talking about like like taking the medicines and different stuff like that?
I take the medicine because I have to. If I go to the doctor and my blood pressure is up high still, they're gonna realize I ain't been taking my blood pressure medicine like I'm supposed to, or they're gonna think I'm really stressed and I need more blood pressure medicine. So guess what? And then instead of having 48 pills, I'm gonna have 49 pills. So they're gonna give me another one. So I'm trying to do my very best at everything that I do so that I can be okay, you know, and I'm trying to get myself ready for the surgery.
Maybe, Auntie, and I'm not trying to be funny, but maybe if you looked at it in another light.
And that's what I'm trying to do.
Not the medicines, because, you know, I can't really preach on that.
Okay.
But I could say, like, for example, the smoothies and stuff. I made it more like, and you said you've been doing them, you know what I mean? And I ain't gonna lie, I see you doing them.
Right.
You know, but what I'm saying is like, maybe it's like, maybe look at it more fun.
And that's what I'm trying to do. And that's what I try to do. But, you know, sometimes, hey, Auntie, I get a little overwhelmed sometimes. And then sometimes, I ain't gonna lie, y'all, sometimes I feel like the potato chips be calling me.
But I don't think, okay, I'm not saying that it's just, but I don't
beat myself up if I eat a bag of chips.
I was just about to say that. That's what I was gonna say.
I be sucking the juice.
I didn't want to say that like and make it seem like, you know,
it's
just
okay
like forget it,
just
forgive it, you know. Yeah. But I don't think it's that bad if you eat.
So that's why, and a lot of people, let me tell you something. People, if you used to come to my house and you've been in my house and you really know me, I used to have a closet full of snacks. I had somebody dub me the nickname Snacks because I had all the snacks in my room. I had a shelf full of stuff. You know what I'm saying? I had a closet full of stuff. I always had this. I always had that. I got the snacks. I don't buy no dang on snacks no more. I get mad at nighttime sometimes. I ain't got no snacks.
That's crazy. It's stuff that you be saying that makes me so mad because I be like, dude, like, oh, like she almost had me or something, like, because I don't know what it is.
I was gonna kidnap
Why
you.
Do you not
if
understand?
The situation didn't happen the way it happened, you would have been kidnapped.
Do you not understand that I buy chips all the time?
Yes. Listen,
my mama be so mad at me. She be like, "That's what." I be like, "Girl, leave me alone. I'm gonna buy chips.
Just gonna give me some, just a little bit.
I'm gonna get some chips. I just need to get smoothies too.
She gonna get us some chips."
Like, I don't know what it is.
But
like,
yeah, sometimes I be like, man, the other night, I ain't gonna even lie to you. I had to move my car. I couldn't find my shoes. And I found my shoes. If I hadn't found my shoes, I got in my car and moved it to the back without no shoes on. I had my socks. If I'd found my shoes, I'd have been down at that gas station, but I couldn't find my shoes. I wasn't gonna walk in the gas. I ain't that ghetto. I wasn't going in the gas station without no shoes on. I wanted my niece, I was gonna wake her up, but she was snoring so loud. I'm like, oh. Hey, Pepper. Come go to the gas station with me, go in there for me, okay? And plus, I don't like the man at the gas station at the nighttime, man. Snackness. But I'm telling you, the man at the gas station, I can't stand him. The second shift dude. There's two dudes that work there. They do 2 12-hour shifts. The nighttime dude, I promise, if I had the energy in me, I probably would just wait for him one day and beat him up after.
Oh my God! Oh my God!
He one of them people you want to sit wait for him to get off work and you want to bust his head.
Oh my God!
Don't nobody every time I go in.
Who is this man?
I don't know. I think he and you know what? I think he's a foreigner, but he's like a nigga.
You want me to beat him up?
Yeah,
I got you.
Okay, thank you. I appreciate it. I'm telling you, the man. I'm telling you something. I don't like him so much. I go in there if I buy something, if I know what it costs. Yes, the gas station man, Kamario. Let me just tell you, this mother. I go in there. Sometimes I bought something for $4. The dude he'll charge you $6 for this or $12 for this. If you don't watch him, the dude will be trying to get you. But what I do, I go in there. I figure out how much the stuff costs. I add my stuff up, and I just throw the money in and walk out. Don't even stop. Like, If I gotta go in there when he's there. If I got to.
You talking about the regular gas station right there on the corner?
Right there on the corner on 42nd Street.
Right,
the dude, he could work at 7 o'clock.
Say less, I'm gonna be up there.
The one dude, he looked like a...
He'll be up there at 7 today?
Yeah, he'll be up there at 7 today.
Okay.
Yeah, he wanted them. He wanted to bust him in his face. Oh, and he'll cheat kids too. He cheat kids because he'll cheat kids.
Auntie is mad. She's mad, y'all.
Don't see no kid in that gas station on 42nd and Silver Spring with your full car because he will cheat them. Give them $1 and let them go get what they can get with that $1. Because I'm telling you, the man will cheat him. I swear to God, I had to go in there and cuss that man out one day. Oh, I had to cuss his soul out. And then I went in there one time. I don't even buy lottery tickets. I went in there. I didn't buy lottery tickets. But if it's up to 100 million, I might buy me a couple just okay. Give me a couple quick picks just in case I might win one number and win me a couple $100. You know, hey, I'm due for that.
That's bogus.
I'm due for that.
Not the kids though.
Yeah, he'll cheat the shit out the kids. Especially if they want them kids that just want some junk and can't.
I'm about to have Maya going there at 7 o'clock. Now I'm mad. I'm finna go at 7:30. We gonna be at the gas station. So if y'all see me on the news, just know.
You better park your car around the corner and just run down the street to my house.
I got you.
I'm gonna hide you. I'm gonna say I ain't saying nothing. Did she look like me have a big booty? Oh, it wasn't me.
Somebody gonna pull up this podcast in the face. They're gonna be on the face. You said
my podcast. You said. I'm gonna be like Bootsy. I can't stand a snitch. But if you relate to the man at the gas station on 42nd and Silver that goes to work at 7 o'clock, you tell him I said he's a bitch.
She did not say it, y'all. His company ain't got nothing. That's how you know it's real. He didn't got nothing on the
I
comment.
can't stand that man. Mario, your comment is just blank. Let me touch it. And I tried to touch it and make it come alive.
Hey, what's that gift, that GIF? I said gift. Be like, ooh.
But yeah, that man, he's something. I'm telling you, nobody likes him. I went in there one day. I was like, I had to get some gas. My, you know how your gas thing go ding, and then you drove a little bit too long and forgot about it. And you see it go ding again. So I had to go in there and get some gas that day. I only got $10 because I don't even want to buy no gas from him. But I had to go in there and pay for the gas. He said he sent me some stars. Aww. Thank you, Kamaria. I appreciate those stars, baby.
That's so sweet.
But yeah, that man, I went in and paid for the gas. I thought the people were finna, this dude was gonna go postal on him. He cussed that man. I was like, oh shoot. I had to run out the gas station. I was like, let me put my gas real fast. I'm like, stay down in the car, kids. Because I had Bailey and Malachi car. Y'all lay down in the car because if with the shooting, I don't want nothing coming this way and being off my car and getting y'all. Let me pump this gas. Look, I'm at the gas pump pumping real fast because that man was cussing him out so bad. Oh my God, he deserved it. He deserved it, y'all. I swear to God, I ain't gonna lie to y'all. The man deserved it. He cussed him out so bad because you study overcharging people. And then let me tell you what happened. Now, this Bing thing happened to me last night too. This Bing thing I had to get some gas, and there was where I had to get the gas at. So I'm going to get in there. And I said, I went there yesterday morning because it binged on me. Was it this morning? Was it this? It was yesterday. I think it was Monday morning. What's today? Tuesday? Monday. Yeah, Monday. Oh, it was this morning then. Shoot, dang, my days is up.
I was like,
so I'm going to get the gas. I go in there, and it's early because it's time to take baby to school. So it's before he got off. So I'm about to say he'll get there to 7:30, something like that. So it's like, I'm like, I need to get $20 on pump 5. I go out there. I'm trying to pump the gas. It ain't pumping. It ain't pumping. So I go back in the gas station. I be like, what's wrong with the pump? Oh, you said pump 1. The man was in the, he said, no, she didn't. She said pump 5. Cause I'm like, did I say pump 1?
And that's the same dude?
It's the same dude. It's the
He
bitch.
doesn't like you.
It's the bitch.
He don't like you.
I said, it's the white lady over there at pump 1. I said, so why am I coming here paying for her gas? How you put my gas? Oh, I gotta cancel that order and then do it over. Well, do it then. You know I already paid for it. Oh, you gotta ring it up again. I just looked at him like this. Like I said, she did say pump 5 though. I said, thank you. And I just paid for the gas again. I took my baby to school, checked my car, make sure my other money went back to my car, which it did. Because I didn't want to go back up there and bust his head.
Because you know they be getting you off of like
Yeah,
that.
try to.
I got like that up, you know, like that. Okay, so you know the gas station right before you get to the border of Illinois.
Mm-hmm.
I got play right there. So like, well, that's Centralia, not Centralia, but I'm thinking Illinois. What's that? Caledonia or whatever that is right there.
Okay, I know you're talking
Or
about.
right, Racine.
Caledonia.
Yeah,
Okay.
in that area,
Mm-hmm.
I got played. $20.
No, I'd have went back there to give me my $20 if
Yeah,
it was on my
sure
way
did.
back home. I went. I'll do call my credit card company and said I dispute that charge.
I mean, I tried to, but I just left it alone because at this point I was just like whatever. Like I done got played.
Come on, y'all told him no.
You is a young hot thing though.
Ooh, yes, my name. That's my last name, young.
Oh Lord, there she go. There she go. You should never boosted this lady head up.
She better side of it. And she said, in my auntie said, in her neck of the woods, dude, or they got you.
Yeah, it was a YT person. We're gonna say that. YT person.
Okay.
But yeah, they got me.
But yeah, that I would went back. I don't care. I'd have went back on my way back home. I'd have stopped right there and said, listen here. I want my money back.
Yep.
I don't care if it's 50 cents. Give me my money back. Now I've been to gas stations and paid for gas and tried to fill up the tank and then it didn't take all the gas and use my card. And then I wait. By the time I get down the road, about a half an hour or so down the line, it'll finally go through and it'll change the amount and be the correct amount that I posted in it. That's why I always get a receipt or I always write it down. This is I gotta go, love y'all. Enjoy the rest of the podcast. Okay, Kamaya, we love you. Okay,
thank you for coming on here.
Yeah, you gotta come keep checking us out, checking in.
Yep, everybody needs to subscribe to our channel. Subscribe and save our page.
Yep.
Different things like that before y'all log off. Share.
Yeah.
Who is this? Oh.
You got on speaking.
You okay? Everything okay? We down here at the thing. We almost done.
Want to be on our podcast?
Done. We only got a couple more minutes.
Want to be on our podcast?
Okay.
We call you right back. She said, "Ooh."
But yeah. But
so you gotta watch them real. Watch them on the real. They try to double that. They try to double text you. Yeah. Mm-hmm.
Yep.
Yeah.
But yeah, we just basically just wanted to share about the healthcare today.
And if you didn't catch us from the beginning, I need y'all to really go back and rewatch this podcast because Stephanie gave out some gems. She gave out some gems. Shoot, I don't care about y'all. I got mine from it because I got that number. And I'm gonna be calling her.
And another thing too, and I just learned about it today because I still get WIC from my young child. The WIC office on Titonia and Capitol is closed down, guys.
Really?
So don't. I mean, this is just another gym. So if you're used to that one and sending people over there that lived in that area, that they closed that one down. They sending you either on 3rd Street or Fond du Lac over here at the health department.
Okay, up there, so, like by the police bar.
Mm-hmm.
Okay, up there.
Like right there, it's either those two they sending you to now.
I think that's.
So I'm just letting you guys know if anybody y'all know that's on WIC, they don't have that one over on Titonia anymore. They shut down in June.
Oh wow.
Yeah. So June is I think the 1st or whatever is gonna be like the last day they got there. So that's another gym, just in case.
Yeah, but I want y'all to be on the lookout.
I almost think we should have her again real soon.
Yeah. I think we should. I think like I told her, maybe we can rotate her once a month through here for a while, so that people can understand and get that. And if she, I was thinking twice a month, but I didn't want to overdo it for her, but at least once a month we need to get her back. Well, maybe we'll try to get her back not this week, but next week, the following week, and just to kind of reiterate it again. But please, if you don't do nothing else,
save that number.
Yeah,
share that number with people.
Yep, that number is 988-3079. If you don't see it up there, because that's a good number to have, and that I'm tell you the Finley Clinic is up on 107th and Capitol. And you can Google it. It's there. And if nothing else, they can help you with. They'll help you get you some health care.
Yep.
They'll help you with your medicine. You can get some free medication if you can't afford your medication. If you don't have health care, they can get you some discounted rate healthcare, and they get you some medical screenings and stuff like that for at a very low rate. If they get you your insurance, and they can get you your insurance approved and everything, I'm sure they'll do it right on their insurance at that point for you. So just know that there's always ways to get that what you need.
Please start listening to your body.
Yes. And don't think you ain't just getting old. You ain't just getting old. I know, I'm telling you something. Ain't nowhere in the world that I'm getting up and feeling this way and that way all of a sudden. It ain't because of my age. I blamed it on my age for a minute until I started doing different stuff for my body to try to feel better. Don't think I ain't at the top of my game yet. Not yet again, but I will be back at the top of my game again.
Yes, you will.
Real soon. Because I have reasons to want to be healthy and feel good. And you know what I'm saying? And live. And I didn't want to say live. Only reason why I didn't want to say live because you can walk across the street, get hit by a bus and die. But
that don't mean that you didn't want to live.
Exactly.
That don't mean you didn't want to live. That's just
exactly.
Well, not
I don't want to do nothing to myself prematurely.
Yeah.
To just give up on my health and just let it deteriorate and then be a burden on my daughter. Because that's not fair. Yes, your children are supposed to take care of your parents. I think that's the way it's supposed to be. I don't care what you say. Children are supposed to take care of their parents. But I'm not going to purposely make myself a burden on her.
Right.
You know what I'm saying? I want to be one of them spunky grandmamas and mamas that the daughters and kids be saying, Mama, slow down. Where you going now? What you doing?
I mean, you already old.
Trying to find you
what
a
you trying to
dad.
get ancient? We trying to figure out what's the steps.
Huh? What'd you say? Say it again. Say it again. Yeah, I'm gonna have to rewind this film. I'm gonna have to rewind this film. I hear her.
I said she already. She trying to get ancient.
Yes. I want to be one of them little spunky grandmas.
You know I'm messing with you. I just have to say it.
I take it.
Because you're not old.
I don't feel old either.
Look, and the older I get, I tell y'all not old, so I don't.
Hey, listen, when I was getting older, I used to say, it used to be 25 was middle age. Then, as I was getting older, 30 was middle age. Then 40 was middle age. Shoot. Right now, I think 55 is middle age. I ain't there yet, so I ain't even middle age yet.
Just imagine when I was like 15, and I used to be calling all my older cousins that was like 25, 30. I used to call them old people, and now I'm the old people.
Now you the old people.
So I think it's so funny, because you just don't realize how not old that is.
It's not very old at all.
Like, for real.
It's not, and that's funny. That is funny.
But yep, I'm happy that we had this discussion today. This was a good one.
This was a very good one, and I like I said, we're gonna have Stephanie back here. But please, if you got a few minutes, just go back and listen to the first part of this podcast where Stephanie joined us and came in, maybe like 16 to 20 minutes into the podcast. Just go. I'm just trying to give you a point of origin to go back to and listen to the gems that she dropped here, because it's very important. It's very important, and I just really appreciate her coming on here. And I'm gonna be honest, I've been knowing Stephanie since I think almost before you was born, Destiny. You know what I'm saying? And here in the last few years, I didn't even realize I'm so wrapped up in doing what I'm doing in my life. I knew Stephanie was a professional woman and she was doing things, but I just didn't know exactly what she was doing. So I'm happy to have had her here to understand what she's doing, especially with the different methods of trying to find alternative ways to trying to heal your body. And that's I can't say the word, that's why I won't say the holistic.
No, you said it right.
Okay. Yeah. So finding holistic ways to heal your body and to take care of yourself. and to make yourself feel better. If I don't do nothing but make myself feel better,
Yes.
if it ain't healing me, it ain't doing nothing else. I feel better, and when I feel better, I want to do more, and I get a little more spunkier. So that's when I'm at with that. So I just want to thank everybody that was here, that joined us, and I want to thank Stephanie for coming, and we want you back. I want you back. Okay, but yeah, we're gonna have you come back, Stephanie, because you dropped some gems, and I think it's important for our people and for our society, for us to understand what's out here for us. And like she said, even if you can't make it to her, call her. That number 988-3079, 414-988-3079. Call. Ask for healthcare. What did she say? Healthcare.
Um,
So,
I think it's representative.
yeah. Ask somebody to help you with. You need some. Just tell them you need some help trying to find yourself some. See if you're eligible or to reapply for your healthcare, or so you can apply to get your healthcare stuff in order. Let them know what you want. They know who you need to talk to. A coordinator, a healthcare coordinator.
Yeah, that's what it was.
You know what I'm saying? So you just need to talk to the right person. That's all, and just let them know. Hey, look, I had some insurance, but I ain't renew it because I ain't know how.
Yeah, she was telling us that a lot of the Medicare and Medicaid.
Yeah, during the pandemic, they were just renewing your stuff. Joe Biden signed a bill where during the pandemic they just renewed you.
So basically, she's trying to make sure that everybody get insurance.
Yeah, that you stay insured because
insured,
if you didn't renew it when they send you that 6 months paperwork, you don't renew it, you won't have it. So
go back and listen.
Yeah, go back and listen. And so she broke it down, and she let you know what her clinic, what they provide. You know what I'm saying, and to help us out. You know what I'm saying. So I really, really, really would like for you guys to do that. Just for yourself and your own health care.
And that's another one of those things. If you really do go visit or really go and share that information and have proof.
Mm-hmm.
I'll give you a discount on the hairstyle.
Yeah.
But I need the proof though.
Exactly.
Because like I said, this is information that's just not just for us. It's for one person. It's for everybody. Your whole household. Anything can happen at any moment. You got a mother, you got a dad, kids, different stuff like that. Anything can happen, and we can use that information. We can share that information.
Yeah, exactly.
So if you know somebody that go visit, tell them to send you a picture. And if they send you a picture, you have proof. I'll give you a discount on the hairstyle. Period. It ain't nothing else to it.
Exactly.
So,
exactly.
We got to start working together on the more positive things, and stop promoting all this negative stuff. This is something positive that's good for all of us, every person in the community.
Exactly, and that's what we need to work on doing, being positive and just subscribe to our YouTube channel, y'all. I just put it down there. I put it out there. I'm gonna start putting it up on the on our banner, the YouTube, because anybody that subscribes to my YouTube channel, you can get 10% off your a single T-shirt order. If you want to get a shirt, if you need a shirt done, come in here. You or any one of my products, you can get 10%. I'll give you 10% off. Just come and get your T-shirt made. Come get you something get something done. One of my products, I'm gonna give you 10% off. So when you subscribe to my YouTube channel, let me know that you did it, and then
you're not pressing.
I know I'm pushing the wrong thing. I'm not crazy, but
after you do it,
I know I'm trying to figure out what I did. I'm craziness. See y'all got me messing up my banner. I'm trying to hook y'all up with the real information so it can be here. But yeah, just subscribe to our YouTube channel, and then scroll and then add banner. Yes, ma'am. Okay. Now where? Okay, there you go. Yeah. Okay. So yeah, that's our scrolling across. That's my YouTube channel. It's Custom Prints and Designs by Pamela Young. If you type that into your YouTube browser, it'll pop it up. Subscribe to the channel, and you can go back and watch any of our funny YouTube old broadcasters. They're all out there for y'all to look at and to see. So for y'all to to do that. So we appreciate that if y'all do, and get you 10% off of your next order. And that'll be cool for you. But yeah, again, I'm gonna ask y'all to go back and look again. Look at check out what Stephanie had to offer. Oh, my stomach is growling. I'm not drinking me some more juice. My juice. I need some juice, Stephanie. Damn.
Did it
Destiny.
get Auntie, huh?
Yeah, I did it again. Destiny is causing me problems, y'all, today.
No, don't blame it on me.
No, come on.
I think you gotta press edit, huh?
I hit edit. And it was up there.
Oh, I know what happened. Okay.
Destiny messing me up, y'all.
No, don't believe her, y'all. I ain't do it. Not today. Not this time.
Mm-hmm.
Space.
Man, I go back in here. At least it's on there now, though. I can go back and edit it. Now you're gonna have space.
Well, you gotta go down now, Auntie.
I am down there.
No, you gotta. No. Move the thing down. Okay, there.
Okay. Yay! It only took me 2 hours. I've only been off air 3 days now. Yay!
Yep.
But yep, y'all. Please just check that out. I care about everybody's health care. I care about us being a healthy people. If we ain't healthy, we can't fight the battles that we need to fight.
And please start wrapping it up. That's help.
And make them wrap it up too.
Make them wrap it up, y'all.
Yeah. But go back. I mean, if nothing else, you can't do nothing. Go back and maybe like 15, 20 minutes into the broadcast and catch Stephanie, the gems that she dropped and information that she dropped, because there's some very important information there for you, for your health care and things that you can do. Anytime you can be given something to help you live longer and a better productive life while you're here, it's important. Yep. So I just recommend that you guys go back and check that out. So Destiny, what you got planned for this week? What's going on this week?
Only thing I got to do really is I got hair clients. So I got 2 hair clients tomorrow. Mm-hmm. And then get an oil change on Wednesday.
Wednesday you gotta be here early because I gotta go get tires Wednesday.
You gotta get tires and I gotta get an oil change.
Yeah, what time you gonna get your oil change? When I get through get my tires?
I said 9:30.
Oh Lord have mercy.
Yeah, they set the appointment for 9:30. Honda did.
Okay.
What time you gotta go get your oil?
I'm gonna go right after I drop Betty off at school in the morning. I gotta go all the way out into Waukesha.
And I gotta go to
Greenfield?
No. Like by Southridge.
Okay.
No.
Greendale.
I'm tripping, Auntie. By
West Allis?
No, Mayfair. But like out there though.
Oh,
like 100 or something.
Okay, yeah. You're going like the West Allis then.
Yeah.
Okay, well I mean, that's fine.
But other than that, honestly, not too much and nothing after that. That was it really. Okay. One of my friend's birthday is, I think it was Wednesday or Thursday. Uh-huh. And then my mama's birthday on Saturday.
Okay. Now what you doing for your mom? You got something planned for her? Then Mother's Day.
I know. Sunday.
She be costing too much.
She one of those people that be talking about I need 2 gifts.
Well, you better buy her
I'm gonna buy her what's them gifts that like go together?
Yeah, that's what I'm saying. Buy her a fupa and then some body wash.
I have like 2 gifts.
That's too bad. Hey, but you know what? I haven't checked on it yet, but Bath and Body Works supposed to be shut down.
I know, and guess what, Auntie? They supposed to be selling it.
They were selling. Who are they selling it to? They say
they trying to find owners.
Yeah, but right now they're in bankruptcy, and they're trying to sell off all their products. So there's going to be discounted. So that's fine, man.
And Bath and Beyond, Bed Bath and Beyond, I think.
Shut up! No, I ain't heard about that one.
And
I heard that,
maybe it is Bath and Body Works, but maybe somebody said the wrong name, the wrong company, if that makes sense.
yeah, I think I don't know about Bed Bath and Beyond, but I know yeah, because I'm gonna be honest, I love their candles. Um, I love their candles, so
I wonder if that's the same company then. Bed Bath and Beyond.
I don't think they are. I'm gonna be honest.
Okay, so maybe it is Bath and Body Works then. Maybe I just said the wrong company.
It's very, very possible. But I'd say I was gonna go out there. I wanted to go out there before the before the end of the month and just try to see what they got going on.
But what they selling for? I mean, have anybody figured that out?
What they selling?
Why they going bankrupt?
They said they're not. They went bankrupt. They said they're not making any money.
How they not making money? People buy that stuff every day.
Yeah, you're right.
But I mean, to be honest with you, you came out with too many products at one time. Like, come on now. Like, that's probably why you went broke.
Well, guess what? Now you saying that, and I get that, and I understand that, and I'm not saying, but that's why I always tell people when they want to start a clothing line, don't think you're gonna come out here with 50 different pieces. You is not Gucci.
I swear.
You ain't got that kind of money.
And that's she ain't talking about me, but she talking to me. Yeah. And the only reason why I'm saying that is because at the end of the day, you know what I'm saying, I done came out with, you know, different hats, which, you know what I'm saying, I'm working on a couple more, but that's it.
But it's hats. You're dealing with hats. You're not dealing with trying to do hats, shoes, cups, paper napkins, all kind. You know what I'm saying? Hats. If you're sticking in a hat area, in a t-shirt area, yeah, that's the area that you're sticking in. That's not overdoing it. You looking at what you have, what you're trying to do, and things like that. So
I guess what I'm saying is, though, if people ain't buying too much of this, you get what I'm trying to say?
Right.
You got to promote your stuff. You have to. You got to promote. You got to overly promote your stuff. And sometimes, and it's sad to say, sometimes you do got to find ambassadors and give discounts and stuff like that. You gotta.
But you gotta find out what works for you. And Gucci do it. Everybody do it. What you think? Why you think? Right now, why do you think that they fight with Kanye West? Kanye West was one of their ambassadors. They had Kanye West out there. He was the person in front. Now they mad at him because he said something that they said he said that he didn't say like he said it. But I understood what he was saying. But you want to make him into saying something different, you know, because they want to say he was talking about Jewish people or something like that.
I ain't trying to be funny, but forget Jewish people. I'm just saying, like,
she anti-Semitic, y'all.
Listen, man. I'm gonna keep it real with y'all. People be sitting up here trying to pacify stuff. The reason why everybody be so scared to say something is because they got the money, and they the ones that's running most of everything. But they always tell you that the person with the money, you know.
Yeah, but my thing
don't kiss their butt. It's sad to say.
I'm not gonna kiss their ass. You know, F them. Fuck them.
You ain't did nothing for me that I know of, besides open up banks. And I don't even use y'all banks. I don't.
And then y'all don't want to get nobody no money. Shit.
I mean, I might use it and I don't know I use it. But I'm saying like a real bank, I don't go to the bank. I'm sorry. I'm one of the people that like to keep their money on them. No. Because you already know until you go to the bank and try to get your money. And you already know the first thing they tell you, you got to wait a certain amount of time. I don't want to wait. When I brought my $100,000 up in here, y'all was willing to take it, but I can't take my $100,000 up out of here until 4 days later, a week later. No, give me my money.
Or it's just somebody named Susie sign off on me on my money. Cut Susie throat.
I'm telling you, you better tell Susie to bring my money back. Because it's about to go down. It's about to go down. Like straight up. So that's the reason why I don't care for banks that much. Like I said, I be thinking too much into stuff. Right. I mean, that could be a problem, but it could possibly be a good thing too.
Yeah.
Like
I get that. No, I understand that. I understand what you're saying. I don't like when they I don't like some processes of bank. I don't like you telling me I only can get this much out at a time. I put the money in. I do use banks. I'm not one of those people. I don't like to carry cash because I like to spend cash too much.
So I don't carry cash, but I don't like you telling me how much money I can pull out of a time machine at a time.
For real.
That ain't your mother freaking business. Bastard.
Exactly.
If I want to take my money out, I should be able to take what I want out.
Period.
But I learned my way around that one too. So when it comes down to it, I learned my way around that one too.
It just upsets me.
It pisses me off.
Like, and it's like, yeah, I just think it's crazy. Like, but again, another rabbit hole.
Right.
I love that statement, rabbit hole. I don't know why I like saying it so much. This is the only time in my life I've been saying it so much, and I like it.
Okay, all right, you got your new saying. Down that rabbit hole.
Down the rabbit hole, because I'm telling you.
I wanna you like my outfit? I designed this. This is gonna be coming out one of my up and coming new awakening line. You know, I'm trying to come out with the shirts.
Yeah.
And the leggings to go with it.
Yeah.
I don't know if you can see it, but it got like this has got loyalty up here, and then it like breaks it down. The loyalty, what the loyalty means, and then on this side right here on my leg, you got loyalty coming down one leg side over here. Then the other side, I got the wake up and stay woke over here on this leg.
I like that.
And then
you should make that side bigger.
Yeah. This is a prop because what I did was I was looking at the shirts and the shirt, and I was looking at the shirt things that I had. And I said, oh, I'm going to use that, the loyalty down here. And I'm going to take the awakening part and put it down the leg. And then put my little tag back here. I don't want to show y'all all my. I got something on the back, but I ain't going to show it to y'all. Because I got it back there. On the back of my pants.
Oh.
See, then I got my awakening logo. It might be on this side. What side is it?
No, it ain't on there.
Yeah,
it ain't. It must not be on them leggings.
There you go.
Oh, okay. Okay.
Got my logo back there.
Yeah.
So, yeah.
You should make that a little bigger too.
Yeah, I probably would do it. Just the logo, but like the tag. Let me see. Oh, do I see it on there? Okay,
yeah, you can see it.
Hey, bam.
But I like it. I like that, and I like this too. But I feel like this should like go up just a little bit right here, and then just a little bit bigger, like bigger.
Okay.
But I like it.
Okay, thank you.
No,
I appreciate it. No, I wanted your opinion. I didn't say anything when you first came in. I wanted you to notice it and say something.
No,
but you was doing everything else.
We ain't gonna tell y'all what I did.
This is one thing I'm not gonna tell on her.
We ain't gonna tell y'all what I did.
I'm not gonna tell this one on her. One thing I'm not gonna tell her.
Let's just say I was busy when I walked in. Let's just say. But anyway, so but I did notice the shirt though.
You did. Okay.
Yeah, but not one.
And then the first thing
I didn't notice the leggings though. I didn't notice that it had the
words
designs on it. Yep.
But then the first thing I did this morning when I came in here is I'm trying to rush and stuff, and I brought all the stuff because she told me she can come out and do my juicing. It's got
grape juice on it.
Yeah, juice from my juicer, and the stuff I'm carrying all this stuff, trying to carry this stuff in, and got my shirt a little messed up. But I caught myself scrubbed it a little bit. But it'll be all right. I'll wash it out. It'll be good. But yeah, this is one of my prototypes.
I'm happy we had this one though. This was a good one.
Yeah,
and I can't wait for us to talk some more about health. I think what I'm gonna do is try to really look up some more like free places.
Right. Okay.
Like free stuff for like maybe on our next one I'll drop some of them gems.
Okay. We'll throw it in our little strolling banner.
Yeah. Maybe I could look up like free dentist, free this, free that. You know what I mean? Like
exactly
different stuff like that people could actually use.
Yeah. And
resources, because the girl I tagged, I had tagged her on my page. Mm-hmm. She got she do free hairstyles for homeless ladies on Sundays.
Okay.
Or like she do like free hairstyles for homeless people on Sundays or something like that. So like long story short, I had tagged her in it because she could use those resources and tell people more about like if they need healthcare and stuff like that, or if they So I be trying to really like connect and network with the people around me and stuff like that. It's slow, but it's getting there. It's getting there. You know what I'm saying? So, but yeah. So I just had to drop that in there.
Exactly. Okay, so y'all, we're gonna get out of here. We got 2 minutes. just to wrap this all up. But I want y'all to start looking out. I'm gonna be looking for I'm looking for people who wanted to be extras in my commercial.
It say unmute mic. Oh, okay.
Yeah, this one is definitely muted. Yeah, I'm looking for people that want to be extras in my commercial. I'm working on my commercial and my documentary.
I want to be the cafe girl on it. No, I'm tripping. I gotta be.
But you could be the cat. You could be cafe and the beauty bar. Because when we film them, we're gonna film them in two different ways. Two different.
It might be two different. My outfit.
It might be two different days. Okay, since you want to keep calling me, you want to be on my podcast? You want to be on my podcast? Hey y'all, how y'all doing? Yeah, look at her. She ain't got her hair combed either, y'all. I'm putting it out there. Okay, I'll call you back as soon as I get off. I'm almost done. Love you. Okay. But okay, see that's how I'm gonna start doing, folks. I'm gonna start putting them out there with nappy heads and everything. Okay.
No, but extras. She said.
Yeah, I'm looking for extras because I'm getting ready to start filming different scenes. Just let me know if you want to be an extra or something like that, and I'll let you know what day come down and what we're gonna be filming. It's gonna be everything is gonna be probably starting out in the next week or two, because like I said, the documentary. I'm doing a documentary, and I'm gonna do the documentary is going to incorporate the commercial. So it's going to be a whole little wang dang doodle for me here. So
that's going to be nice.
Yeah. I'm excited. I'm going to tell you something. I didn't think about the documentary until I was talking to the guy on the phone. And he was like, he sent me his list of different stuff that he do and his price list and stuff like that. And I was like thinking, man, okay, this. And he was like, well, no, I don't think your commercial is going to fall in the documentary area. I said, well, why wouldn't it? I said, because, see, I think the documentary is what's going to explain who I am, mm-hmm. to get people to understand what I've been through, how I went from here to here. And it's also going to help me, because sometimes I don't see my own growth. Mm-hmm. You know what I'm saying?
I don't see how you don't see it.
I'm telling you, and this is
you done had several establishments. You done had all types of stuff. I remember being a youngin, right here, right down the street.
I don't even just with custom prints. I can say, okay, I went from my living room to the Milwaukee Mall, to 27th and Burleigh, then to 47th and Burleigh, and now I'm here. And then all the different stuff that I'm mm-hmm. doing at this moment. Mm-hmm. I can look from working in my living room, working third shift, doing both of these things. I can see myself. I can see myself doing all of this, and I'm like, go from working a full-time job that was my security blanket, mm-hmm. to not working a full-time job, and this just becoming what it had to be. Mm-hmm. You know what I'm saying? And I felt the pressure, but I didn't feel the pressure, if that makes sense to you. You know what I'm saying? I knew I had to make this much money by the end of the month in order to pay my rent at the store, pay my bills at home, take care of my child, and this other extra stuff that I need to do. Make sure I keep my supplies up, this. And I knew that's what I had to do, but it didn't dawn on me. Probably it didn't dawn on me until recently that I have kind of made it. I say kind of because I'm not as secure as I want to be.
Right. That's just
financially. And so by me not being as secure as I want to be financially, I know I need to turn it up a little bit more and do something more. So I looked at everything. I looked at all my spendings over the last 2 years, mm-hmm. and I seen some of the frivolous stuff, and that's a good thing. That's a good thing about not always spending cash. Now I can't track all the cash that I spend,
right?
But I can track
the debits and
the debits and the credits and all that kind of stuff that I spent in the last 2 years, and really look at my lifestyle. So it's a couple things that I got to do different. Mm-hmm. And so if I can waste $500 over here, waste $1,000 over here, waste $300 over here, it's other stuff that I need to do for my business to step my game up so that I can achieve the level that I think that I should be at and doing the things that I want to do.
Right.
So therefore, it's on and popping.
Yes.
Popping.
Well, I'm so happy that we We did this one today.
I'm happy you're here. I'm happy you're feeling a lot better.
Yes.
I'm good. I'm happy
Yeah,
you're
I
feeling a
feel
lot better.
20 times better.
Okay.
I done got a lot of rest.
Good.
I feel like me getting these clients that I've been getting with the hair, it's been like really like getting me excited. You know what I mean? So and I've been killing it.
Okay.
Not only have I just been getting clients, I've been killing it, and they've been coming out looking great. I done did a 16-year-old hair for her.
16, yeah, I saw that.
She was so cute.
She was very cute. I saw
she
the
did
before,
her thing.
I saw the before and after and in
oh
the
my,
middle.
Auntie, no, you got to see the pictures on my page.
Oh, okay.
When you get the time, you got to go on her photo shoot. She went crazy.
Did she go crazy?
Yes, and she looks so adorable. Oh my God. So like I've really been excited about making these young ladies and these ladies feel beautiful. You next.
I know, because I got to do something to this.
Because you said what you wanted, a natural hairstyle? Yeah,
I want me a natural hairstyle. I'm going to get rid of the braids for a while, you know, the dreads and stuff. And then just I want to puff it out for a while and just wear some natural hair for a couple
So I got a couple hairstyles and a couple ideas that I really, you know what I'm saying, I've been thinking about and stuff. You got to keep going. She got on purple. Okay. Yeah. But long story short, thank y'all. Please subscribe. Please love our channel, like our channel. Please share this one because this is, like we said, real important about healthcare. And we love y'all. Thank you.
We love y'all. Thank you. Bye.
See y'all later.
See you later.